Hello, everybody. My name is Jennifer Barr. I am the owner of Downtown Kennett Nutrition and Weight Management Center with us. I have a special guest, Dr. Neil Mushlin, which we're going to introduce him in just a second. He is a pulmonologist and he has practices in Exton, Westchester, and Lansdale, so throughout Pennsylvania and where our practices are. He is also he loves learning and teaching, and he teaches at Family Practice, the residents for Drexel and Einstein, and also the Philadelphia College of Osteopathic Medicine. Dr. Mushlin is pretty amazing. He is super passionate about sleep and health, and I actually met him because he reached out and found us and said, I need help. My patients are not eating well, and that's how our relationship got together. And I have to say, you're amazing, and actually someone in our family, in our practice, actually ends up seeing you and tells me, we love Dr. Mushlin. So he is super passionate about lifestyle and change and nutrition and definitely sleep. So welcome.
Thank you so much. It's a pleasure to be here.
Now, why would I want to interview Dr. Mushlin? Well, let me tell you. So sleep. If you came into our office, you know, one of the first things that we talk to you about is how many hours of sleep you get per night and what are your stress levels. And if you tell me less than 7 hours of sleep, I always say, you know, that has to be corrected before you can go on to eat a healthy diet and to help you reach your health goals that you have, whether that's control diabetes, lower your blood pressure, weight loss. It could even be fertility issues. Sleep is your wheelhouse for all those things. And so many of you don't get restful sleep or do not sleep throughout the night. And it's a big part of health. Your brain, your frontal lobe, your control center is your basically your headquarters. And when you're not getting enough sleep, it stops working and it makes you tired. And that's where if you're going for late night snacking and those carb salty cravings, a lot of that stems from not a lack of sleep. So if you're not sleeping enough and you're having these late night eating, it's actually tied together. And Dr. Mushlin,
you bring up a great point. I just want to interrupt real quick, but what a lot of people don't know is if you are up for 19 hours straight and you take a driving simulation test, it's the same as if you're legally intoxicated. And so is mild sleep apnea. So, I mean, a lot of us, I know in our younger years, and unfortunately some of us now in our older years are not getting the sleep we need. And, you know, it impacts us. And you're absolutely right. You can't think straight. You make poor decisions. Your memory is down. Your cravings completely change. You can actually crave about 900 more calories a day. Some of the important proteins and hormones in our body, like leptin and ghrelin, which I know that you look at with your patients, those levels are off. It takes you longer to get full, and you're hungry more often, and you crave the wrong types of food. So, you know, with what you do with nutrition and weight loss management, what I do with sleep, the two of them really go hand in hand. And it's really important, you know, if we want to get into people's optimal goals and optimal nutritional plans, to really get a good hold of their sleep, to make sure, one, they are sleeping enough, and two, the sleep quality is good, and to treat any underlying sleep disordered breathing, which 25% of the population has, is important.
25%. Wow.
Well, it's interesting because the number 25% was before the pandemic. And as you know, different studies out there saying people probably gained about 1.5 pounds each month during pandemic. So I'm sure the numbers that we have right now are even higher than we had a year ago. And, you know, one of the talks I give, I look at the average BMI per state. If we look back in 1985, we consider BMI over 30, you know, to be obese. Probably about in each state, about 10 to 15% of their population has it. If you look again through the CDC numbers now, which is about 35 years later, probably most states are in about the 25 to 30% range where people are considered obese. So a lot of the numbers that we're giving you for sleep apnea studies are done years ago. And as we know, the BMI is going up and up and up. And the BMI and sleep apnea, even though there are many other risk factors other than just obesity definitely is a risk factor for sleep apnea. So the more obese we're getting as a country, the more patients we have that have sleep apnea.
Yeah, absolutely. And it has grown. And you're right. We have seen in our practice with this pandemic is really a lot of lack of movement. People don't realize, like, when they were driving to work and parking their car and walking, that was actually movement that was actually burning calories too. So
Yes.
you're right, like it's a huge problem growing worse.
Absolutely.
Tell us a little bit about your pulmonary practices and what you do there.
Yeah, so at this point in my career, I started my own practice a little over 3 years ago. And we really just focused on outpatient only. And since the pandemic, has been a mix of in person, I should say. We just do outpatient only and telemedicine. And for the sleep, telemedicine is actually a very effective tool, as I'm sure your practice has transitioned that way as well. Sleep, for the most part, is a lot of education, talking to patient, getting a history, and we really are a practice that does a lot of work with home sleep tests. Back in the day, people had to sleep into a lab, which was a big deterrent to getting tested, where you'd have to stay away from home. You got wired from head to toe. You had you and your hair for the different leads. And now we have, yeah, I mean, look, that's what we had back then, and reading those tests, this was before my time, but it wasn't even computerized. So you basically had stacks and stacks of paper with a lot of squiggly lines you had to go through. But now the technology has changed, and we have home sleep tests that people can pick up. And even now we have ones that we can mail to patients' homes. And they're really easy tests. It's a band that goes around the chest, little prongs up the nose, and little pulse ox on the finger. And that gives us for the most part, about 90% reliability of diagnosing sleep apnea. So we normally give people, one or two tests. The first test is negative. We have a high suspicion. We do another home sleep test. If that's still negative, at that point, we may send them in a lab. But we're able to diagnose and treat a lot of people just based on the home sleep test. And I know you and I have had conversations before, and there's many different treatments. People think it's just CPAP, and CPAP is a great treatment, and it's a lot different than it was, even 5-10 years ago. The masks are much different. There's masks that, besides covering your whole face, can just cover the nose or go up the nose. It's no longer just a hard plastic. There's a lot of very soft gel cushions. They realize that men and women have different faces and different contours, and there's masks that come in all different shapes for different faces. And there's auto-adjustable machines now, and a lot of the machines even work on remote monitoring. So we can actually look at a person's data when they're home and remotely make changes. So the CPAPs have come a long way. But other than CPAP, one of the big things that I do in my practice is I send people for oral appliances. So people that have mild or moderate sleep apnea can do very well with the mouthpiece. And what the mouthpiece basically does, it just brings the jaw forward and opens the back of the airway. So I'm not sure if anyone's ever seen like any of the medical dramas on TVs or the movies, but there's something called the jaw thrust maneuver, where you take the angle of the jaw and you bring it forward. By bringing it forward, you're opening the back of the airway. That's essentially what you're doing with a mouthpiece. So sleep apnea is a mechanical problem where you have a decrease or a cessation of airflow. So the way a CPAP works is it basically just blows an airflow into you like you would blow a balloon up. There has to be enough pressure going into the balloon to separate the rubber so the air goes through. What the oral appliance does is it brings the jaw forward and then basically opens up the back of the airway. So I tell people it's like, if you drink out of a straw from, one of the big chain restaurants, you have a big thick straw. It's a lot easier to, to breathe or suck through that than it would be the little cocktail straws you get when you have a mixed drink. So the bigger the diameter of the airway, the easier it is to get, air through.
And how would someone know they have sleep apnea?
I mean, it's funny because a lot of patients don't know. That's the scary thing. We people that come in and they say, this can't possibly even be me. I'm not tired. I don't snore. And, a lot of us don't know if we snore. I mean, it's really up to a bed partner to tell us if we snore, or someone that's, in the house with us. So the power of Zoom, right? With your cell phone going off and my dog trying to guard the neighborhood and go crazy.
Sorry, guys. This is life on a Friday.
Yeah. So, people don't know. That's the scary thing. So we really look at, again, people can snore. They can wake up gasping for air. They can be tired. Some people wake up with a sour taste in their mouth or reflux. One of the symptoms a lot of people don't realize is people can wake up to urinate all the time. A lot of people think it's a prostate, but actually sleep apnea will present, especially middle-aged women. They'll wake up to urinate more frequently. But I also look at the disease states. If I see that someone has a stroke, I know there can be about a 90+% chance they have sleep apnea. If they have 90, there's some studies showing 91% of people with strokes can have it. People with different types of heart disease, like coronary disease, heart arrhythmias, like AFib, or heart failure, that can be about 60-70% of people have sleep apnea.
Type 2 diabetes.
Now, diabetes. Well, what's fascinating about diabetes is they've done studies, and when you disrupt slow wave sleep, which is when a lot of your hormone regulation takes place, They took a young group of kids, I think in their early 20s, and whenever they went to slow wave sleep, they set an alarm off to prevent them from having that. And after a couple of days, they actually developed high blood sugars, and they let them go back to their normal sleep pattern, and their blood sugars normalized. So diabetes absolutely goes hand in hand with sleep apnea. Some studies show that depending on your age, as much as maybe 60+% of people with diabetes have sleep apnea, especially when you see the high morning blood sugars. You would think, well, why would you have high morning blood sugars when you're not eating? Well, when your airway collapses, your body is stressed. So what's it do? It releases cortisol. What does cortisol do? Cortisol is a steroid, increases blood sugars. So we absolutely see an overlap between diabetes and high blood sugars with sleep apnea.
And this is why, as dietitians, we ask the question, how many hours of sleep do you get and what are your stress levels? Because I'm not going to get your morning blood sugars down if you're not sleeping well. And this is why.
Absolutely not. Absolutely not. And that's especially why a lot of people develop diabetes later in life, because they don't sleep as well. They have more disrupted sleep, and they have a lot less N3 or slow wave sleep, which we know is related to blood sugars and diabetes. So again, it's a lot of times I'll go by a patient's symptoms, but I also just go by what they tell me. I see someone that has a metabolic syndrome. They're overweight, they have high blood pressure, they have high cholesterol, they have heart disease. I know statistically speaking, there's a really good chance they're going to have sleep apnea. Yeah. And when you look at the three biggest risk factors for death, it's age, hypertension, and moderate to severe sleep apnea. Different studies have actually shown that sleep apnea can take years off of your life and increases your risk of a heart attack or stroke by over 5-fold. So, as much as all the medicines patients take for their diabetes, for the high blood pressure, as important it is to treat all these things during the day, it's just, if not more important, to treat your sleep at night, because it has a big overlap with cardiovascular disease. And I think for years, probably about till 20, 25 years ago, we ignored what we did when we sleep. All the different subspecialties in medicine, were about things that were happening when we're awake in different subspecialties, the heart, lungs, kidneys, endocrine, et cetera. But we ignored the 7-8 hours of sleep we had at night. And I think more and more we're realizing how important that is, and that we sleep for a reason. And it's important to get good quality sleep.
Yeah. So adequate sleep, which is 7+ hours of continuous uninterrupted sleep, correct? That's
the people that live the longest sleep 7-8 hours is what the studies show.
And for those of you that are listening, if you have elevated blood sugars, circulating higher insulin levels, your triglycerides, your cholesterols are elevated, you're having trouble losing weight, even though you think you're eating and moving enough, and it's not making that tick, maybe even you're lifting weights and you're trying to reduce your body fat and gain some lean muscle mass. All of this is related to not getting enough sleep. So you could definitely have sleep apnea, and I'll tell you, I told Dr. Mushlin before, is my daughter had it and got diagnosed when she was like 4.5 or 5. I had no idea. I didn't sleep in the same room as her, and I just remember we slept at someone's house, and one of my cousins slept in the same room and woke me up in the middle of the night. And she's like, your daughter is stopping breathing. She's gasping in the middle of the night. And it was by definition a symptom of sleep apnea. And it became a device that Dr. Mushlin was talking about to widen her mouth. It was just really a structural issue that was happening. And she wasn't even overweight. So it's not always just because you're overweight too.
No, that's a great point. I mean, definitely in our country we're overweight, but there's other countries where people have very normal BMIs, and you still see it. It's genetic. If you have a family history, it's probably about 2 to 3 times more likelihood that your offspring will have it. In addition, it's a lot of the craniofacial structures with the bite, the airway, the tongue. That's all inherited. There's some people in different countries like China, Japan, in Asia, where they have BMIs, they're probably about 3 to 5 points lower than ours, and their sleep apnea is just as severe. And a lot of it is genetic and craniofacial structures.
And are there different populations or different races within our society in America that have more or more at risk for sleep apnea?
That's a great question. It's something I'll probably have to look at. Definitely know the Asian, population is more likely to have it. tobacco use, alcohol use, weight, family history, recessed chin. So there definitely are some, characteristics, but I'll have to take a look and get back to you on that one to see if different nationalities. So yes, a very good question there that I can't answer.
Part two of our discussion. We'll have a Q&A for you guys, and we'll go through.
Absolutely, but I know Jen, you did bring up a great point, which I also want to talk about. Before in the introduction, you talked about like our sexuality. It definitely affects our hormones. It affects men's testosterone levels. In fact, if you have low testosterone, it can actually worsen sleep apnea. Start giving testosterone before treating underlying sleep apnea. You can make your sleep apnea worse. So men with low testosterone, low libido, women, and men that are having infertility definitely could be, because again, a lot of this is hormone regulation that takes place during sleep. And women that are pregnant. I mean, it's very important to treat that because gestational diabetes, gestational hypertension, preeclampsia, all of these are related to sleep apnea. So again, it really affects everything we do in terms of our immune system, with how our body can fight off disease. And you mentioned before the amount of sleep affects your weight. There's a study that showed that the two different groups that had a flu shot, one had 4 hours of sleep, one had 8 hours. The group that slept 8 hours, their flu shot was twice as likely to be effective. So we know our immune system definitely is a huge part of sleep. So that's what I think I love about this. I got into my field because of pulmonary and critical care in the ICU when I was young was exciting, and doing all the procedures. And the more and more I started doing this, the more the sleep just started appealing to me, because I saw all the different ways this can work with preventive medicine. And I really just wanted to focus on my patients to try to get them as healthy as possible and keep them out of hospitals. If you take a look at the hospital before the pandemic, anywhere from 80 to 90% of people that were in the hospital had underlying sleep apnea. And sleep apnea predisposed them to a lot of the reasons and the diseases that put them in the hospital. And you and I both know the people really having trouble in the hospital with COVID are the people that are overweight, have underlying, diabetes, and hypertension. So definitely, the weight and the nutrition is playing a huge part in people not doing well with COVID.
Yeah, 100%. And I want to also just tell everyone, like, you can hear Dr. Mushlin's passion for sure, but I gotta say, I have maybe a handful of doctors that I know that will call us and text us about their patients. Wait, this way. He's one of them. Okay, that is so rare in this day and age, with how practices have so many patients, and we all try to pay our liability insurance and our bills and stuff. It's huge. You care about your patients, and when you said preventative, that just makes my heart kind of thump a beat, because preventative healthcare is how we keep you all out of the hospital, and how we keep you so that you can play with your grandchildren or your great grandchildren, or take that hike, or take that family trip to Great Adventure, Williamsburg, or whatever is your jam. So,
and I think, Jen, that's also setting a good example for our children and our grandchildren, because they're going to grow up seeing what we do. And if they see that we don't have good habits, it's going to be very hard to expect them to not, see what they grew up with and see what their parents are doing. A lot of times people learn from their parents, and they learn the eating habits from how they grew up in their household, and they learn the sleep habits from how they see their parents sleep, making sure they got enough time and making sure they're taking care of themselves. So it's, I think it's not only important for the individual to do this, but it's important to set an example for the next generation, especially if you want your kids to be, live a long, healthy life.
Right. And we all want to try to role model for sure.
Yes.
For that next generation. So I know insurance covers us for almost all of the people that are going to listen to this. Can you tell people about how they would make an appointment, or just maybe further their information to see if it's something they want to try to help them?
Oh, absolutely. Yeah. So we have 3 offices. We also do a lot of telemedicine. I have a license in New Jersey and PA, so anyone in either of those states we can take care of. Our office number is 610-359-5858, and that number will lead to all different offices. So Jen, I know you're a lot more technically intelligent than I am. So I know if you could
everything, don't worry.
Maybe you can kind of put that up on the screen when this plays. So 610-359-5858.
How about a website?
So our website is www.advocarepulmonaryandsleep I'm going to check this. I think it's AdvocarePulmonarySleepDoctor.com, but I will check this right now because
and I will link it. I will link it and all the things for everyone if they're interested to do it. It is a great resource for you to look at.
Yeah, so it's Advocare Pulmonary and Sleep Specialists.com, but I will definitely have you take a look at that, and if you don't mind putting that up on up on the screen. But we open up at 7 a.m. In the morning. We know a lot of people work and they don't want to miss work. So we figure out by having early morning appointments that it is, it gives you a reason to see the doctor and not say I can't fit in my schedule. We also do telemed, which makes it much, very easy. And we can even, if you're not close to our office, we can even mail home sleep tests to your house. But I will tell you that it has changed a lot of our patients' lives. A lot of people don't realize how exhausted they are, how poor their health is, because they're so used to it. They've been living like that, their whole life. And it's like I always joke, like, that fish is in that fish tank that no one ever takes care of. And to the fish, that dirty water is normal. They don't understand anything else. They're living there and their body kind of quote unquote adapted to it. And it's almost like a shock, when they get out of that environment. And people that have sleep apnea don't sleep well. They're exhausted. They have a brain fog. They're not living healthy. They're anxious. They're depressed. They're more likely to be using tobacco, alcohol, recreational drugs, sleeping pills. I mean, the patients I've seen, it's just
to get pregnant, can't lower their blood sugars or their blood pressure, are gaining weight.
Absolutely. I think that's why what you and I do go hand in hand in terms of, what you do to help take care of these patients during the day when they're awake to kind of, eat better and, just perform better. And what I do to make sure that they have restorative sleep at night, so their body and their hormones work the way that, they should work.
Awesome. Well, I really appreciate you taking out this time on Friday afternoon.
It was a pleasure. It was an absolute pleasure. As you can see, I love talking about sleep apnea. I joke I could talk about this so the cows come home from the moon. It's one of my favorite subjects. I'm very passionate about it. And again, this is something 25% of the population has. So, odds are, a lot of people that have it, people don't always talk about it. And the scary thing is, Jen, that 80% of men are not diagnosed and 90% of women are not diagnosed. And women triple the risk of sleep apnea once they go through menopause. So it's very important for us to really get out there and I think to educate and to get people screened. And nowadays with the home sleep test, the screening is really, really easy. And there's other options other than CPAP. So we're trying to do our best to take down the barriers for testing and treatment for this.
I love it. Virtual appointments, mail me my stuff. You're going to walk me through it and troubleshoot it. This doc's got it all, guys. So thank you, Dr. Mushlin, and have a great
My pleasure. You too.